Another day, another vaccination drive in Pakistan. The only difference is these people have paid for their Sputnik coronavirus shot.
Because people would like to vaccinate, because people do realize that this is the only way forward and they have to do this.
Pakistan is one of the first countries in the world to allow commercial imports of COVID-19 vaccines. Up until now, the government has relied on China donating doses, offering free jabs to healthcare workers and people aged over 50. And despite signing up for the World Health Organization's COVAX scheme, the AstraZeneca shots promised are yet to arrive, prompting some hospitals to look at private sales.
We don't expect that this will come in till the second or the third quarter of this year. Those who are below the age of 50 and are now anxious to get the vaccine have been offered this vaccine privately.
There are currently 50,000 doses of Russia's Sputnik 5 destined for the arms of people who can spend $100 on the shots. There are also 10,000 doses of China's CanSino vaccine for commercial use. That costs about $35 per injection, and more doses are set to be imported to keep up with the high demand. Even before the pandemic, around 1 in 4 of Pakistan's 22 million population were too poor to meet basic needs. But in the wake of the health crisis, the government estimates 30% will live below the poverty line. And despite the cost, vaccine recipients say they'll pay the price for peace of mind.
Very happy and thankful क्योंकि अब शायद travel में भी vaccination की requirement हो and generally normal life return हो.
Motive तो यही है again.
My motive is to secure myself and my family. When we feel safe and secure, it will start a trickle-down effect. There is talk about herd immunity. My message is that those who can afford it should be vaccinated as soon as possible.
But is paying for the vaccine ethical, or is it pandemic profiteering?
I think this will help speed up the vaccine delivery to people below the age of 50. And only those people who can afford it will be able to take it. So I think if people want to take advantage of it, for the time being, I think there's nothing wrong with that until the COVAX supply of vaccine comes into the country.
While some can now pay for their vaccination, others continue to wait. Jordyn Butler, ABC News.